Hi, I'm Dr. Jennifer Jackson. I'm a registered nurse and an assistant professor in the Faculty of Nursing at the University of Calgary. And this video is about what is the role of nurses in modern healthcare delivery. And this video is connected to my other video talking about nursing work and nursing labor. So in my PhD, I said, among many things, one of the questions was, how have researchers understood their work? So I did a large literature review to look at that. And then this part of my PhD was saying, how do nurses themselves understand their work? And does that correspond with what is in the literature? Or do they understand their work in a different way? And what I found is that generally nurses understand their work as a role, which is somewhat different than what I found in the literature review. However, I don't think those two different frames of what is nursing, I don't think they're in opposition. I think they just apply to different elements of the work. So what I'm talking through here is what is the role of nurses and why do nurses understand their work as a role? So, again, I've often sort of critiqued as thinking about, why does this matter? We need to focus on clinical practice, we need to focus on implementation and, clinical advancement, but I think it is worth stepping back to say, what is the bigger picture here? Because I feel like that's a place where we can really move things quite far forward if we're willing to engage with that level. So we don't know a lot about how nurses understand the role of their work. And we see a lot of policies, I'm sure you can think of some in your area, where there have been political decisions made about what nurses will and won't do, but it doesn't reflect real nursing work. It reflects ideas or stereotypes or limited views of what nursing is. And so we need to be able to clearly talk about what nurses do so that we can help other people who are making policies understand our work and so that these policies actually help us and are effective for us. I think there's also an element of unifying the profession. So what does a nurse in intensive care have in common with a nurse that is working in a correctional facility and a nurse who is working in a school and a nurse who might be on the International Space Station? What do they all have in common? And I think if we focus on the tasks that nurses do, it's easy to say, this profession doesn't make a lot of sense, everybody does something very different. But when we look at core elements around role, I think we can find a lot in common. So I'm hoping that's what these ideas can contribute towards. So I'm going to spend quite a bit of time going through this slide, but thank you for bearing with me on that. Nurses understand their work as a role, and I've labeled 3 different roles that nurses told me about. So they're presented here in a way that's kind of flat and linear. That's for the purposes of explanation. So this is an illustration. This is not a technical diagram. So I think that nursing roles can overlap. Things can get a bit messy, but for purposes of explaining, I'll go through these each separately. So there's clinical work, managing work, and enabling work. Clinical work is perhaps the most obvious, and when we think of nursing or when we see nursing on TV, it's related to clinical work. And so what clinical work refers to is the work that nurses do in healthcare settings, and it includes direct interactions with patients and with the people who are important to the patients and other members of the healthcare team. But it's not only patient care. There's lots of other things you do in the clinical environment, like answer phone calls, that might not necessarily be patient care. But clinical work includes all of those things that happen at the clinical level or the point of implementation. I think using the term clinical nurse or clinical work is really important because it adds an element of skill If we say staff nurse, regular nurse, those, to me, those things don't sound as skilled as saying clinical work. It helps distinguish this work from others, and also it avoids using violent or like military types of language in nursing, which is kind of another conversation, but it's something I've adopted more over the years. So it helps us avoid things like frontline, because I find frontline is inherently problematic. So that can be a debate for another time, but I think using the term clinical work has a lot of utility. I can imagine that clinical work is quite familiar, so I'm going to move on from that. Managing work, this is where nurses manage the context of care, whether it's like a physical space or whether it's sort of a mental illustration of a space. So managing work is not only nurse managers, although it is nurse managers, but it is not only nurse managers. And this is a unique contribution of nurses to the healthcare system. So we give and assess medications, but we are not pharmacists. We help patients mobilize, but we are not physiotherapists. We help guide the plan of care, but we are not physicians. So what is it that nurses do that no one else does? Managing work. We create the context where the care happens for everyone, not only for nurses. So perhaps the clearest example of that is a ward manager or a unit manager. So that role, the nurses make sure that like the heat is running, the lights are on, there's enough towels, there's enough equipment to put in a chest tube. We have all the systems working, we're getting supplies, all of the supply chain things are happening. There's enough staff, there's the right amount of staff in the right place at the right time. Nurses are the people who do that and who engage with coordinating team members and make sure that everything is running, and that environment is one where it is safe to provide care. The reason we do this and nobody else does is because nurses stay in one place. Physicians are in the emergency department, and then they're in intensive care, and then they're in the radiology suite, and then they're in the operating theater, and they're here, there, and everywhere. Often as well, allied healthcare professionals, so speech language therapists, they might be on 3 or 4 different units or wards, depending on the work they're doing that day, their staffing ratios, that kind of thing. Nurses stay in one place. We don't generally go from ward to ward in the same shift. So because we stay in one place, we make sure that that space is a functional one. And so that is arguably, Florence Nightingale said that the art of nursing was creating the right environment. And there's been lots of definitions of the art of nursing over the years, but I think managing work could be associated with the art of nursing. We create a space where people can heal and where healthcare professionals can do their work. We create that and manage and sustain that environment. If you are in a community setting, you might not be talking about an environment the same way as a ward, because you're invited into a patient's home, and that's very different. But at the same time, you're also thinking about, are there adequate supplies in the home? Do we have enough nurses to get to the homes? Are their vehicles running okay? Does everybody have gas and oil and everything else in their car? Are the cell phones working? Are the driving conditions safe? All of those kinds of things also constitute managing work when you have like a less clearly defined space. So in that case, managing work could fall for a geographic area. But either way, this is something that makes clinical work possible. And I think nurses need to own it as one of our unique contributions to healthcare. Third, we have enabling work. And so enabling work enables managing and clinical work to happen. This is what sustains the profession and the healthcare system. So I would say I currently do enabling work. So because I'm an educator and a researcher, this can also include people who are in formal leadership positions. people who do policy work, people who run the college, the association, the union, that kind of thing. We are all doing enabling work. And it's easy, I find, for my work to get dismissed as I'm not a real nurse and that type of thing. But if you don't have someone in my role, we are not a profession. Now, a profession is a group of people that are self-regulating and have a discrete body of knowledge. So we have nursing knowledge that is developed through our own research. So we use our own knowledge that we have created to do our work. If we're only using medical knowledge, we're not a profession. We might be different things, but we're not a profession. So if we are going to argue that we should be treated and paid like a profession, which I think we should, we need to have the professional structures in place. So, oh, we don't need all the managers, oh, we don't need all of those people that have no touch on reality. Well, if you get rid of all of us, we're not a profession. You cut the legs off from this whole pathway. So what we want to do is look at how nursing roles connect together and value them the whole way along. So the enabling work creates like the socio-political climate where nursing can happen. We educate, we create the knowledge, we create the policies, and we help make sure that all of those things are in place. And that takes a specific skill set. Managing work makes sure that the environment is a place where we can effectively provide care, which takes a specific skill set. Both of those together make sure that clinical work can happen. So I would argue that we can look at the nursing profession as a whole as we are somewhere in this pipeline, if you will, of work. So just because I'm not a clinical nurse does not mean that I'm not nursing or that I'm not a real nurse anymore. It means I'm doing another role that supports the whole structure. So I'm hoping that this is something that can help us see how, the head of the association and the nurse who works in nephrology, how those roles connect together more directly and provide a more unified view of what our profession is. So why does a role matter? I found that nurses very specifically see their work as one of those roles for a reason, because roles allow them to adapt, and adaptation is a constant feature of nursing work. So nurses are adapting all the time. That is a difficult thing to do, and they don't even know that they're doing it, let alone articulating how they're doing it. But they needed a flexible mental frame to be able to adapt. And thinking of your work as a role gives you that. So to try and explain this with a practical example, one of the people I spoke with who did managing work said that one of the things that they did was to support the patients on their long stay unit to have Wi-Fi, free TV, occasionally get some McDonald's or KFC brought in. And those things are not in that nurse's job description. It does not say that in a list of tasks or in a list of competencies, but that nurse could look and say, these patients are going to need care within the system for a long time, well beyond the doors of this unit. And because they're experiencing vulnerability, we need to create trust, we need to build relationships so that we can engage with these people for years to come, because that's what it's going to need to support their medical needs. So if a nurse was following a strict list of tasks or competencies, ordering KFC is not on those. But when the nurse says, my role is to create a therapeutic space where people can heal and where we can build those therapeutic relationships to help the patient, that is a flexible frame. And then whatever kind of activities you throw into that frame can all fit there. So because it's flexible, it allows that adaptation to happen. Further, it helps nurses say, okay, so we have policy, we have theory, we have evidence. Now, how do those apply to this individual person or to this specific patient population? And because they have that flexible mindset, it's not I do A, B, C, it's I do whatever I can in this role to help achieve these goals. So that's why thinking of roles and thinking of adaptation is really important, because nurses exist in complex adaptive systems and they have to have a lot of flexibility and a very high degree of adaptation in their work. So anytime we try and label nursing roles as nurses do A, B, C, nursing associates do X, Y, Z, and nursing assistants do 1, 2, 3, it's not going to work, because that's not how things go. I'm sure you've seen cases in the hospital where, you've got the nurse manager there and you need to move the patient up in bed, or you need to do something quickly. It's technically not their job, but they'll help do it. Or you might go and do something with a colleague that, now I'm not saying go outside your scope of practice, but if you say that's, not necessarily my job, but I need to do it to help achieve patient goals, help create therapeutic space. So that's why we have those roles, and that's why nurses understand their work as a role, is because it helps everything on this slide happen. And so, in light of that, what I think we need to talk about is how nursing is much more than patient care, and having roles of enabling and managing work are essential for a profession, and they also keep our healthcare system rolling. So it's not only about looking after patients, although that is a critical part of our work. I don't look after patients, but I still see my role as essential for nursing, because I'm helping prepare the next generation of nurses, and I'm making sure we have our own body of knowledge that we can draw from when we're doing our work. And without that, we're not a profession anymore. So we need to think in broader terms and talk about our work and talk about the value of all of these different components in order to articulate how nursing roles contribute to healthcare systems. A lot of things need to change, but I'm hoping that if we fix this kind of stuff, I think some of the things happening at the clinical level, I won't say they take care of themselves, because that diminishes the work and the labor that are needed to help make those changes. But I think that if we kind of always work at the local level, we're not going to get the same change as if we say, let's shift our paradigm about this and think about, how do we consider our professional structures. I think there's potential to get a lot more, if you will, bang for our buck at that point. So I offer that we can consider, we need to think about staffing ratios and think about how do these different types of work show up in different roles, and how do we allocate for that? Because it's not only about the number of patients that you have. For example, you might be doing clinical work, but if you are also mentoring a student, you're also doing some enabling work. And that is more work that needs to be taken into account for your assignment on a given day. We need to think about our competencies and job descriptions. I find almost every nursing competency or job description I look at is often like a list of do this, don't do this, this is included, this is not included. In the real world, I don't think that's the case. Like, I have literally recited Shakespeare to a patient. I have helped patients put on their hockey jerseys so that they could watch the game when they're not actively getting care from me. And you know what, that was never on my job description, but it helped build a therapeutic environment and a therapeutic relationship. And therefore, it was a part of care. So we need to think bigger. And we also can change our language. I find, there's like, are you a real nurse? And that is a phrase I wish I could abolish, because I'm a real nurse. I always have been, I always will be. I hold on to that professional identity, and I carry that knowledge and that set of values with me wherever I go. And so our profession is more broad than only clinical work, and we should talk about it that way and take credit for all of the things that are happening amongst our colleagues. So when you are asked what do nurses do, I encourage you to think about, yes, we absolutely care for patients. Nurses do that every day. But we also sustain health systems. And without our whole spectrum of nursing roles, the health systems will fall apart. So we are needed for patient care and beyond that. So here are some references. Also, my thesis is available online. If you're really keen or if you're having trouble sleeping, have a read of that. There's lots there. And you can find more information on my website. There's some plain language summaries there. They're open access, they're visible for anyone, so feel free to use those resources as it's helpful for you. So thank you very much, and I appreciate your interest in this video.